Hey guys, this is Dr. Nikunj and you're watching Dr. Class. So in today's session, we will discuss about the terms related with the clinical condition. We are finding that generally in majority of pathophysiological condition, the suffix behind the organ are similar, like the gastritis, the rhinitis, arthritis and so on. So the generally a best way and the easiest way to understand clinical term is with the help of suffix. So here we will start with some suffix first. The first one is the itis. Basically, itis is the suffix which is the representative of inflammation. Now first of all, we have to understand that what is inflammation. So the inflammation is the living response toward the physical, chemical or antibiotic substance. Right. So now let's understand one by one that the inflammation, what inflammation it is? Inflammation is the living response. Living response toward what? Living response toward the physical or chemical or maybe it is an biological substance. So simply, the inflammation is the response toward any foreign particles who comes inside the body. It should be pathogen, it should be non-pathogen, but the inflammation is our response to deal with it. Now, inflammation gives result due to such a condition, and there are four cardinal signs of inflammation. One of them is redness, the second one is heat, the third one is swelling, and the fourth one is pain. So sometimes this four cardinal feature, redness, heat, swelling and pain, will result into the fifth condition, and that is the loss of physiological function. Okay, so it will lead the loss of functioning, right? So that is the inflammation. Now let's see the related inflammation with the organ. So the itis is referred for the inflammation, which is the combination of redness, heat, swelling, pain, and last but not the least, these all four symptoms will lead to the loss of normal physiological functioning. Now the terms like a tonsillitis is referred. The tonsillitis is what? The tonsillitis. Tonsillitis. So itis is the referring term for the inflammation. So basically tonsillitis is the inflammation of the tonsil. The second one is arthritis. Now what is arthritis? The word arth is the word which is referred to the joint. So the arthritis is the inflammation of joint. This is the inflammation of the joint. Basically there are two kind of arthritis we are seeing daily. That the first one is osteoarthritis and the second one is the rheumatoid arthritis. So after some time we will publish the two separate video on the osteoarthritis as well as the rheumatoid arthritis. So the next terminology is the appendicitis. So the appendicitis is normally the inflammation of appendix. The dermatitis, the word derma is referred to the skin or a mucous membrane. So the dermatitis is the inflammation or a generalized inflammation of skin. Last but not the least, that is the otitis. Here the word oto or a term oto is referred to the ear. So the otitis is the inflammation of ear, and basically we are finding word like a otitis media, which is the inflammation of a middle ear and which is very common. Let's see the next terminology, next suffix is the ectomy. So basically ectomy is the suffix referred for the removal of organ or removal of any part of body. Let's see one by one. The tonsillectomy is the first. The word tonsillectomy is for the removal of tonsils. It should be the surgical one. The next one is appendectomy. So basically appendectomy is a surgical removal of appendix. The gastrectomy, The word gastrectomy is what? It's a surgical removal of any part of GIT, and the word hysterectomy is the surgical removal of uterus. So this was the terms related with the ectomy, which is the removal of the organ, that particular organ. Right now, the another term or another suffix is autonomy. So the autonomy is also a surgical procedure. It is a surgical procedure in which what happened that we have to make the incision and open the hollow organ, and after the surgery you have to close them. So first opening and afterward the closing of that particular hollow organ, that kind of the surgical procedure is now referred with the suffix autonomy. So let's talk one by one. The first one, like this, here you can see this is the hysterectomy. Okay, so the hysterectomy is basically the incision by the which you can open the uterus, and afterward, after the procedure, the closing of uterus should be done. Basically, this kind of situation, the hysterectomy is performed during the LSCS or the cesarean section. The word laparotomy. So laparotomy is referred to the incision on an abdomen, and afterward this kind of first of all, this laparotomy is used for what? Laparotomy is used for the diagnosis of disease and the planning of further major surgery. So here in laparotomy, what you have to do, that in laparotomy, first of all, there is incision performed on the abdomen, and after the procedure, this suture, the part of the abdomen should be sutured out. The next term is hysterectomy. Sorry, not a hysterectomy, it's a hysterotomy. The hysterotomy is here, right? The hysterotomy is the surgical procedure by which the opening, and after the procedure completion, the closing of the uterus. The cystomy is referred for the incision on a cystic bladder, or you can say the urinary bladder. So term ostomy. The suffix ostomy is what? It is very related with the autonomy. The difference between the ostomy and autonomy is that in autonomy, you have to open the part, a hollow organ, and afterward you have to close that. But when you perform a surgical incision, surgical procedure, where you open the part and afterward you will left it open. And that kind of situation, that kind of procedure are suffixed by the ostomy. The colostomy. Basically, colostomy is performed during the time of the injuries, the stabbing wound or external major is the colostomy. Basically, colostomy is performed after the major injury or a major trauma on the abdomen. Generally, the colostomy is done at the left side of body. So what we do here, that after the incision, after the opening up of the colon, the part of the colon should be get up. Opening of the colon is known as colostomy. This is the ileostomy. So basically, ileostomy is performed on a ileum. It is the closuring, the opening, not a closuring, but it is the opening of the ileum. And afterward, we have to remain open the ileum. So the term colostomy is referred for the opening of the colon. The cystostomy is referred for the opening of a urinary bladder. The tracheostomy is what? Tracheostomy is the opening of a trachea. But still, again and again repeat that in ostomy, you don't have to perform closuring of a part. You have to remain still this wound, or you have to remain still is this incision open. The suffix oma is referred to the tumor. Basically, a tumor is excess growth of tissue, which is result due to uncontrolled cell division. Normally, a human cell has affinity to divide once at every 24 hours, and that duration is basically known as the cell cycle. But due to the metabolic deformity, some cell will disturb this cycle and the duration of cell cycle will be reduced off, and that will result more and more cell division, and with more cell division the tissue will get more cells, and this more cell will lead the excess growth of tissue, and that is known as the tumor. Let's look on a figure. So this is the normal view and this is the tumor formatting site. So the normal cells are in manner-wise situation where the cell division is rapid, it will lead the excessive mass of cell, and that is known as the tissue. Basically, there are two kind of tumors. One is benign and second one is malignant. So the lipoma, term lipoma is used for, lipo is for lipid, oma is for tumor. So basically, the tumor form or excess growth of a fat tissue is known as the lipoma. The osteoma is the new growth or excess growth. It should be benign, it should be malignant. Benign are those kind of tumor which has less damage to the tissue, and the malignant are those tumor who give a majority maximum damage towards the tissue or a part. So basically, osteoma should be the benign, it should be malignant, but the osteo is referred for the bone and oma is referred for tumor. So basically, osteoma is the tumor of a bone. Now the neurofibroma. Basically, neurofibroma is the tumor-like situation occur in the neural tissue, but there should not be the increase in the mass of the neuron. It should be there, but generally there is no increase in the neural mass. After finishing the suffix, let's look on other general terms. The first one is puberty. So the puberty is the age where an individual will develop his or her secondary sexual character. Basically, in girls, the puberty is a time period of 12 to 14 years, and in boys, the puberty comes at the time of 13 to 15 years. The next term is the symptom. Basically, a symptom is the subjective sensation of a patient who felt it, and the sign is the objective which is observed by a physician or a doctor. Now, another term is the syndrome. So the syndrome is actually a bunch of symptoms which do not have a direct significant relationship. Okay, so a group of diverse symptoms is known as the syndrome. The next term is diagnosis. Basically, a diagnosis is the identification of a disease or the identification of a nature of a disease. The next term is the prognosis. Basically, a prognosis is the assumption of the progression of disease or the outcome of the next term is edema. Edema is what? Edema is the accumulation of fluid inside the interstitial space. Now, what is interstitial space? Basically, the interstitial space is the space between cells. Normally, cell possess space in between them, and that space is known as the interstitial space. And in between them, a fluid present that is known as the extracellular fluid. So the term extracellular fluid means what? The fluid present outside the cell or in between the cell space, and that is known as the extracellular fluid. This fluid present inside the cell is known as the intracellular fluid or ICF. The normal value of ICF is about 60% and the normal value of ECF is about 40%. But if due to anything or penetration of any physiological or physical, chemical or biological substance, the osmolarity, okay, if due to the presence of external agent, the osmolarity increase, this kind of situation will lead to the exoosmosis. So what is exoosmosis? Exoosmosis is a condition where the water drain out from the cell and accumulate inside the ECF. So it will result more amount of fluid inside the ECF, it will result more volume of ECF, and that kind of situation is generally known as the edema. Let's look a figure. Okay, so this one is the edematous condition. Now the edema has two types. The first one is the non-pitting edema and the second one is the pitting edema. Basically, the non-pitting edemas are those while you after pitting, if the surface area get back normal, so that kind of situation are the non-pitting edema. But if pit still remain after, that kind of situation is known as the pitting edema. So let's look on a next term, and that is the coagulation of blood. Basically, the coagulation blood is the defense mechanism of any organism. When we get a cut or a wound on our surface, on a body surface, it will lead the bleeding. And for the protection of blood loss, the mechanism occur with some factors of a clotting agent as well as the fibrinogen and some platelets, and that kind of situation is known as the coagulation of blood. So basically, coagulation of blood is a relevant condition, or you can say a preventive method for us, but sometimes it will lead more damage, like in an intravascular coagulation. So the intravascular coagulation lead so many of complication. So the intravascular coagulation lead the complication like a thrombosis and embolism. So what is thrombosis? So thrombosis is nothing but the accumulation of blood or the blood clotting inside the vessel. Let's look the example. So suppose this is the artery. Okay, so first thing first, that the artery consists three layers. The outer one is known as tunica externa, the inner one is known as tunica intima and or interna, and the third one, which is the middle one, and the middle one is known as the tunica media. Now let's see the mechanism or pathophysiology. So this is the normal structure of the blood vessel wall. Now what happened here, if due to some reasons or the excessive fat consumption, the fat accumulation start inside. Okay, if the fat accumulation start in between the tunica media and tunica intima, it will result to the plaque formation. And if this plaque will become bigger, what it will lead? It will lead the narrowing of the lumen, and afterward the narrowing of lumen will lead to the passing blood forcefully. If this passing of blood forcefully will lead what to the breakdown of, you can say the breakdown of the tunica intima, and this breakdown of tunica intima will result the direct exposure of this fatty tissue, or you can say the direct exposure of this fat tissue with the blood will lead the coagulation reaction, and it will result what? It will result the coagulation in the vessel. So here what happened, that the thrombus is formed. This formed clot in the vessel or a vascularization is known as the thrombus. This is known as the thrombus, and the reaction, the process of reaction is known as the thrombosis. So this kind of reaction is known as the thrombosis. Now let's look. The thrombus cannot be sustained at that particular place due to the pressure of blood. Afterward, what happened? The thrombus will detach from this site and run inside the blood current. So what happened here? The thrombus will run inside the blood capillaries or blood vessels for a so long period, and now this floating thrombus, right? What I said, the floating thrombus inside or a running thrombus is known as the embolus. The floating thrombus is known as the embolus. And the reaction, the process of embolus formation and the running of thrombus inside the blood is known as the embolism. Right. So these are the intravascular coagulation of the blood. So let's look on a next term like a hemorrhage. So the hemorrhage is nothing but the loss of blood from the external or internal, or you can say a bleeding external or internal. The external bleeding can be seen from outside, okay, and it should be lead the hemorrhagic shock. The excess bleeding will lead the hemorrhagic shock. The bleeding should be internal. So here you can see the bleeding or a hemorrhage inside the brain, which is the cranial hemorrhage. So next thing is the ulcer. So basically ulcer is nothing but the erosion. Ulcer is what? Ulcer is the discontinuation. Ulcer is the discontinuation, or you can say a erosion on the skin or mucous membrane. So this erosion or a discontinuation of skin which lead the irritation to the blood vessel, irritation to the tissue, okay, or a part, right? So the ulcer should be superficial like this. Okay, so this is the ulcer on a skin. Ulcer should be happen on a mucous membrane. So the mucous membrane ulcer will lead more difficulty in the functioning. So here you can see the ulcer on a stomach, and that is known as the gastric ulcer. So this is the example of the gastric ulcer, right? So gastric ulcer is the example of mucous membrane ulcer, and the superficial ulcer are basically a skin ulcer, right? So the ulcer is nothing but the discontinuation or erosion of the skin and the mucous membrane. So let's look next. Okay, so next term is the sinus and the fistula. That the sinus and the fistula are the relative terms. But the sinus is the blind tract. Sinus is the blind sac or a tract. Clear? Right? With the single opening. It is the single opening sac or the blind tract. Clear? Right? So we can find a sinus in the maxillary region and the zygomatic region. Okay, so this is the sinus, and the inflammation of sinus is basically known as the sinusitis, as we learn that the inflammation is the referred by the itis. Okay, so sinusitis means the inflammation of the sinus. Basically the sinus having only a single opening. This is the character. The single opening blind tract is known as the sinus, and the sac or a tract with the two opening, so there is the entry point as well as the exit point present. Here entry point is present but there is no exit, right? So that is sinus. But if there is two opening there and one is the entry and second one is exit, this is for the understanding only, right? So the place or a tract with the single opening is known as the sinus, and a tract with two opening is basically known as the fistula. So let's look on the necrosis now. So necrosis what? Necrosis is the local death of a tissue. Necrosis is the local death of tissue, right? So another term related with the necrosis is the apoptosis. Necrosis is the local death of a tissue, and the apoptosis is the programmed death. Okay, we will learn apoptosis more in the physiological portion, right? So apoptosis is what? Apoptosis is the programmed death, where the necrosis is the unprogrammed local death of tissue. So here you can see the death of tissue. This is the necrosis in the renal region or a cortical region of the kidney. Clear? So let's look next, the gangrene. So gangrene is much related with the necrosis. After the necrosis, if tissue will done the putrefaction, so basically gangrene is what? It's a necrosis. It's a necrosis with putrefaction. So the necrosis with putrefaction is basically known as the gangrene. Clear? And now let's see the type of gangrene. Basically the gangrene has three types. One is dry, wet, and the third one is the gas gangrene. Okay, so gangrene also we will discuss it in the pathology part. Okay, so let's see next term, and that is the atrophy. Right, so let's look both two terms. One is atrophy and the second one is the dystrophy. So the atrophy and dystrophy have this two terminology has the same meaning. The atrophy and dystrophy is meaning as the reduction in the size of tissue. This is the reduction in the size of tissue, but the thing is without, okay, this is the reduction but without any change. This is the reduction in the size of a tissue but without any change in the number of cells. So if the tissue get reduced in their size but there is no any change in the cell number, that kind of situation should be the atrophy and the dystrophy. Then what is the reason for the diminishing in the size? And the reason is the lack of nutrition. Okay, so let's revise it. due to the lack of nutrition. If the tissue will reduce their size but without changing in the number of cells, that kind of situation is known as the atrophy and the dystrophy. The another term is the hypertrophy. So hypertrophy is as the atrophy and dystrophy. The funda is what? There is no change. There is no change in the number of cells, but there is change in the size. Okay, so it is the vice versa. Then the dystrophy and atrophy, it is the increase in size. This one is the increase in size of tissue. It is the increase in size of tissue without any change in the number of cells. Clear? So hypertrophy is basically seen in the skeletal muscle basically, right? So when a bodybuilder performing the exercise, they burn out, or you can say they break the muscle, and afterward due to the excess or good nutrition, the proteinous diet, they will gain the nutrition, and with the afterward due to the metabolic reaction with the influence of RER, rough endoplasmic reticulum, they create a protein, right, and the cell will become larger, right? So that is the hypertrophy, but there is no change in the number of cells. Now let's see the next terms. Hyperplasia. Now the hyperplasia is also meaning the increase in the size of the tissue. Increase in the size of the tissue, right? Now we get confused that the hypertrophy was also a size of increase in the size of tissue. Here also the increase in the size of tissue, but the difference is that the hypertrophy was there and there is no any significant change in the number of cells. But here the size of tissue is increased due to the increase in number of cell as well, and that is the difference between the hyperplasia and the hypertrophy. So let's next see the hypoplasia. So hypoplasia is a condition same as the atrophy as well as the dystrophy, but the change is that the hypoplasia is the less, okay, it is the less developed tissue. This one is the less developed tissue due to the lack in the number of cells. There was no change in the number of cells, but here due to the lack of less in the number of cells, there is less developed. Clear? And the last term is aplasia. Basically aplasia is what? It is the failure. Aplasia is the failure to develop a tissue. Okay, so here what we find that the hyperplasia is increase in the size due to the increase in the number of cells. The hypoplasia is less developed tissue, and the aplasia is the failure into development. Let's see the next term, and that is the paralysis. So basically the paralysis is what? Paralysis is the loss of the motor sensation or a motor movement. Okay, so the loss of movement or loss of the motor supply of nerve is known as the paralysis. Clear? And it should be with the injury in neurons or a nerve, and it should be without the injury to the neuron or the nerve. Okay, so let's see next the hemiplegia. So hemiplegia is a kind of paralysis of a half body. Okay, so if the person get paralysis in the half body, whether it's a right sided or whether it's a left sided, that kind of situation is known as the hemiplegia. After hemiplegia, let's see the paraplegia. So basically the paraplegia is the paralysis of the both lower limb. The next one is the monoplasia. So monoplasia is the paralysis of one of the four limb, and the quadriplegia is the paralysis, complete paralysis of all four limbs. Okay, what we learn here, that the paraplegia is the paralysis of both lower limb. Okay, both the lower limb. Here what we find that the mono is referred for one. Okay, it is a paralysis of only one limb, and the quadriplegia, quadri for four. Okay, quadri for four. Right here what we learn that the quadriplegia is a paralysis of all four limbs, and that is the anesthesia. Okay, so basically the word aesthesia is related with the sensation. It is related with the sensation, right? So anesthesia means what? It is the loss of the touch sensation. It is the loss of the touch sensation. Here the touch sensation will get reduced or lost. Clear? The next term is the hyperesthesia. Hyper means more, aesthesia means sensation, right? So when a person get extreme sensation to something, okay, over sensitivity towards the touch, pressure, pain, everything, that is known as the hyperesthesia. Okay, the next term is thermesthesia. Okay, thermesthesia means what? Therma is referred for the temperature. Okay, so it is the loss of, this one is the loss of sensation toward the temperature or a heat, right? The next thing is the analgesia. So analgesia is the loss of pain sensation. Okay, so this one is what? This is the loss of the pain. Last but not the least, that is the paresthesia. So paresthesia is actually the pervert sensation of feeling, right? The feeling of that kind of thing which is not really existing, right? So that kind of thing is that kind of situation is known as the paresthesia. So basically the paresthesia is related with the deformity in the CNS. So let's look on a next term, right? And that is the coma, right? Okay, so next one is the coma. So coma is the deep unconsciousness. Okay, so let's look on the next one, and that is a tumor. We already discussed about this, that the tumor is the increase in the size of tissue due to the uncontrolled cell division, right? We already discussed about that. It should be the benign, it should be the malignant, right? Normally the benign means what? Benign means those tumor, okay, those tumor which are the stationary. So benign tumor are the stationary, right? Who can the tumor can be cannot be spread actually. Okay, so here the benign tumor is that which is the stationary, so it cannot be spread on other direction or other tissue. The malignant tumor are those tumor who have, or the tumor has the ability to get metastasis. Okay, so metastasis is the process by which a cancerous cell, a tumor producing cell, can go from one side of a tissue form to the other tissue, and it will produce tumor at a different site as well. Okay, so that property of tumor is known as the metastasis. And the metastatic tumor, a tumor has a metastatic property, that kind of tumor are known as the malignant tumor. Okay, so let's say the next term is the carcinoma. So basically a carcinoma is the malignant tumor. Carcinoma is the malignant tumor of a tissue developed from the endodermis and the endodome and the ectoderm. So basically carcinoma is the malignant tumor of epithelial tissue, right? Because all epithelial tissues are developed from the endoderm and ectoderm. What about the mesoderm? So the malignant tumor of mesoderm, okay, so malignant tumor of the mesodermal origin is basically known as the sarcoma. So the sarcoma is nothing but the malignant tumor of the mesodermal origin. The next one is the cancer. So the cancer is the combined term for the all malignant tumor, right? The metastasis we already discussed about, that the metastasis is nothing but a spreading property of a cancerous or a tumorous cell from one side to the another side. The convalescence period is what? The convalescence period is the period of the recovery from, or you can say the ending of disease to the restoring complete health. So it is just a period of recovering, right? So this is all about the general terms for the clinical condition. Thank you for watching. Please don't forget to like, share and subscribe.